How do you get that nurse residency position that you want so dang bad without blending into the crowd and what everybody else is saying on this episode of the Earn It podcast? There are ebbs and there are flows, and it always depends on where it is that you're applying for your nurse residency positions. Some places, sometime, you can easily get a job, pretty much any job you want right out of nursing school. And other times, no matter how good you can't get the spot that you want. So how is it that you stay competitive? Right now, in a lot of different areas, you have close to 100 or more applicants applying for a handful of spots in a residency program. So how is it that you can get what you would like? There's a couple of things that you have to realize. The first thing is that there are very competitive specialties out there because a lot of people graduate nursing school or go to nursing school. They don't want to work in med-surg, at least long term. They want to get right into a unit that they at least think while going to nursing school or prior going to nursing school that they want to work in. I myself, before going into nursing school, was really hardcore. I want to work in the emergency department, and that is now the last place that I want to work. And I have discovered that through a bunch of different experiences, and I'm kind of glad because that is probably one of the most competitive specialties to get into. These are like the top competitive specialties. ICU is a big one. Emergency is obviously another big one. The NICU is a huge one. Labor and delivery, pediatrics, and the OR. These are all very highly competitive specialties for nurse residencies. So there are a lot of common misconceptions. When you're in school for so long and you're in such an intense program like nursing school, you tend to think that grades matter a lot more than they actually do. So there's a lot of common misconceptions. One of them is that you have to have like a 4.0 or something in order to get a spot. Thinking that because you have healthcare experience, you're automatically going to get hired. Thinking that nobody reads your cover letters. And if you don't get the specialty you want right away, your entire career is ruined, which you have to realize is just not the case. If you're going to nursing school to be a nurse, and you think that you want to be a nurse for the rest of your life, then why would you be concerned about not working exactly where you want to work for the rest of your life just for a year? Maybe 2 tops. 2 years is a drop in the bucket, and 2 years of experience or more is a really powerful tool. Talk about getting the job that you want. After you have a couple of years of proven experience under your belt, that's when you really can get to pick and choose. But that's not what this episode is about. Let's talk about first the hiring process. Obviously, you have initial HR screening. Basically, do you have the degree? Did you pass the NCLEX? Are you going to pass the NCLEX? Yada, yada. Some places use an applicant tracking systems, which there are specific ways to get through or make sure that you don't immediately get blocked, rather, by different systems, especially with the use of AI, to just go through and read your resume. If you use AI to completely create your resume, it's probably going to be detected as AI by a system. A recruiter will review it. Sometimes a nurse manager will review it. But really, it's kind of like becoming what big tech is like, where a recruiter is in charge for the initial screening of an applicant, and the hiring manager is not going to speak to you until after at least one interview. This is kind of like how it is to be hired at like a big time place. So it's something to keep in mind, right? When you apply for that residency program, the people that are generally reviewing what you need are comparing it, reading your resume and comparing it with everybody else, is comparing what you have versus the list that they are given by some other group of people as far as things to look out for. And what that means is they are not always completely in touch with the clinical environment. These people that are initially screening your information are not people that work in healthcare in direct patient care. These folks work in HR. These folks are recruiters. So you need to keep that in mind first and foremost. And that's going to lead into when I start talking about resume and stuff. Now, I'm going to tell you right off the top of the bat, I am not going to do a long spiel on resumes. All of us going through nursing school have to listen to resume lectures. I promise you I'm not going to do that in this episode. I'm going to bring up one single thing that a lot of people ignore, including myself, 99% of the time. It's not about just being qualified. It's about standing out among the other qualified applicants. You have to think, when you're applying for a nurse residency position, everybody else that is applying for the same position that you want, they all have one thing in common with you. They are graduating nursing school. So as far as in the nursing standpoint, you're all on the same kind of, you're all on the same level as far as that. It's everything else that you'll need to do to differentiate yourself. You have to realize a large portion of people that are graduating nursing school also are previously CNAs, or were medical assistants, or were EMTs. So they're used to seeing, oh, look at this person. They graduated nursing school. They used to be an EMT. They used to be a CNA. This is very common for them, and I'm just letting you know it's not going to impress them. Although, compared to no clinical experience whatsoever, it is definitely a bonus, but as competitive as nursing schools are to get into, chances are you're going up against a lot of people that do have clinical experience. This doesn't mean if you don't have any clinical experience at all, you shouldn't try applying for the job that you want. And I'll talk about that a little bit later. So basically, you do need to highlight your clinical experience, but you need to understand that you're not highlighting the generalized experience. No position on your resume, no position that you talk about is going to do anything to differentiate you from everybody else applying for that job. It doesn't matter what the job position is. It doesn't matter how long you've had it. What matters is that you can communicate and articulate to who you're talking to or to who's reading your resume why that clinical experience gives you some sort of advantage over other applicants. What real-world specific examples does that foster for you to be able to apply to your career as a nurse? That is important to realize. It took me forever to understand that. Oh yeah, you worked 10 years as this. Okay, why do we care? Oh, it's because actually these are the things that I dealt with all the time. A, B, C, D, E, F, G. You name them out, you name specific instances. This is why in a lot of formal interviews when they're kind of reading off of a list of interview questions, that some of them sound corny. They're like, tell us about a time where blank, 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 right? This is for a very specific reason. They don't, looking at your position or the bullet points of duties or skills that you have is one thing, but listening to your actual experiences is what really matters. So you could BS this and you could BS your resume, but you better have a damn good story, but you better have one ready for every single kind of situation that they're going to ask you about. You better be able to think on your feet if you don't have that prepared, if you plan on just winging it. Any kind of leadership experience would be great. Any part of organizations. So if you're not involved with any kind of honor societies or clubs, or you haven't tried to start a club or be a part of anything extracurricular at your job, no matter what your job is, but especially if it's clinical, how do you involve yourself more with your job? Okay. They want to know this because leader experience basically means somebody that's not just showing up just to do the job, collect the paycheck and go home. Because guess what? Everybody that made it through nursing school and passed the NCLEX and is applying for the position, they can all do that. This is what you don't realize. There is a lot less special about you than you realize. The amount of special inside of you is one or two things and, maybe more, but it might come down to one thing that sticks out among 100 other applicants. And right now, because you think you have all this experience, or you can list a bunch of skills, you can talk about a bunch of things that you've done in the same kind of setting, or the people that you can choose to name drop too. That all doesn't matter so much because what you're doing is you're drowning out the serious differentiator about yourself, and you just don't feel the need to display that. And that's going to be what costs you. So that's why something like leadership experience of any kind really does matter. Academic performance. These do not secure a position, especially alone. A lot of the times nobody's going to ask about your grades. Nobody's going to be able to check your grades. And frankly, nobody's going to care about your grades, and they really shouldn't matter in a lot of circumstances. You could get really good grades and have no idea what you're doing on the floor, and vice versa. And honestly, people know that. It's about how you perform. Are you a team player? Are you going to be willing and able to learn on the job? Are you going to do the right thing when it matters? How are you going to handle stress and pressure of the job and not just immediately quit? How are you going to not cause harm? How are you not going to bring litigation to our hospital? There are all kinds of things. It goes a lot deeper than your grades. Your grades don't matter. If you make good grades, big whoop and a big pat on the back for you, but nobody else cares. Just to let you know, nobody gives a crap about what your grades are. Obviously, if you have a good GPA, whatever, you can kind of put that somewhere, but I wouldn't bring it up unless you're asked about it in an interview. Be like, oh yeah, and I did this. Oh, and by the way, where I got a 4.0. That sounds a bit like entitled, and they're gonna think that you're a know-it-all, even if you're not. Don't come across as a know-it-all in a freaking interview, and especially don't look like a know-it-all when you're just submitted your resume. Speaking of resumes, I said I'm not going to do a big thing on resumes. We're hitting the 12-minute mark on this podcast, and I hope to be done with this by minute 13 or 14. You start catering your resume to the specific position. And what you need to do is what I said earlier. You need to take your whatever positions you have, whatever experience you have, you need to draw out very specific and hopefully measurable instances. If you can put numbers in there in some way, something that is objective, quantitative data, right? That shows them that you know what you're doing and you're going to be able to handle it. Specific examples when appropriate. You're not going to list off a bunch of experiences that you had. I'll kind of go over this later. We're going to get over that. But make sure you have the good formatting, no spelling, no grammar issues, obviously. But you really do have to tailor it. And what I recently did is the last time I made a resume prior to the one I just did, I was like, oh, well, I know I want to work in the ER and that's where I'm going to apply to. So I made my resume specifically highlighting urgency, quick prioritization, thinking on my feet. And now I no longer want to work in the ER. And in fact, I really don't want to work there. So I noticed just how much I had to change. This is important, I tailored my resume previously to the ER. And I tailored my new resume to pediatrics, okay? One of my new resumes, should I say, because I'm going to take my own advice here. And what I really want is something else entirely. And what I will be doing is I will be tailoring that resume. The amount of things I had to change from emergency department attracted kind of resume to pediatrics was insane. It really is a lot of work, but also it can take as little as 10 minutes. Take advantage of people that say that they will review your resume professionally. I did this, and even though I thought I had a really good resume and they said, oh, you have a really good resume, this is excellent, you could get away with not changing anything, they were like, here's a list of like 25 things that you can change on your resume, even after they said you wouldn't have to change anything on it. So I would seek professional advice when possible. And I'm not talking about your professors unless they hire people, unless they're involved in this process. You need to reach out. They're specific members of most faculties. It's their job to review resumes. I know the 4-year college that I go to during the summer for my BSN, they had this as a service, and I definitely took advantage. And holy crap, the amount of things that I learned after like 15 years of making resumes and getting good jobs, I still had so much that I needed to change. That's enough about resume. Interview stuff. I'm going to go pretty deep into this because this is where you will land your job at. other than the networking part, which I'll talk about a little bit, there are common questions in every interview, right? Tell me about yourself. Why this specialty? Why this hospital? Tell me about a conflict. Tell me about a mistake you made, and tell me your strengths and weaknesses. Don't do the bullshit where you turn a weakness into a strength. Don't do it. Everybody does it. It's cliche. Even if it's what you would normally do. What you have to realize in this case, and only in the case of highly competitive specialties or highly competitive residencies in general, you have to do everything to make yourself stand out in a good way. So it's not about having the right answers. It's about having unique answers. I want that to sink in for a second. You need to have all of this. Everything that you answer needs to be very specific to you. You need to purposely go out and look at, okay, I'm interviewing for this pediatric ICU job. You can find common questions and common cliche answers that other people will give, and to make sure that you don't give these answers. I'm going to go over a few of these because I had to recently do this for interview. Let's go through a few different specialties. Here are some kind of cliche answers. I want to work in the ICU. Let's start about ICU. I like high acuity. I love adrenaline. I want to use all my skills. I enjoy the challenge of complicated patients. I like critical care. These are all highly cliche answers, and everybody says the same shit. So you need to make sure that you have a correct answer. And here's how you need to craft a unique answer. It needs to revolve around either curiosity. It needs to invoke maybe more questions from your interviewer. If you give them an answer and they immediately feel the need to ask you more about that, because of something interesting, not because you were unclear, but because something was so interesting in what you said that they have to know more. They have to be like, yeah. They're going to remember it. Like I said, you have to give unique answers, right? Not just have the answer right away and not sound good when you're saying it. It needs to understand problem solving, understanding pathophysiology, complex disease processes. So just to let you know, this is what the common answers are in the ICU. And some of them overlap with the emergency department. People say that they get bored easily. They love chaos. Again, they love adrenaline. They are calm in stressful situations. That's a big one. I love the excitement. I thrive in a fast-paced environment, and every day and every patient is different. Here is what emergency department nurses and nurse managers will hear. As soon as you say all of those things, they'll think that you just watch a lot of TV. They'll think that you have a glorified idea of what working in the emergency room is going to be like. And they know that that's not the reality. It's not cool. It's really difficult. There's constant interruptions. There's difficult patients that scream and cuss at you, throw bodily fluids on you, will try to actively hurt you. There's family that will absolutely be freaking out. You're going to, in the emergency room, you're going to have a patient die, and then you're going to get done with that and walk in the next room, and somebody that's had the sniffles at 3 a.m. is going to be screaming at you and calling you names because they've been waiting for 6 hours, and they've had the sniffles for almost 2 days. You have to understand that these things is what the majority of what you deal with is going to be a bunch of nothing burgers coming in. Some of them because they don't pay for their insurance and they're literally bored and they love the attention, and they want to be able to tell their family members this thing that they went through at the hospital, and some of them are just coming in because they're hypochondriacs. Some of them are coming in because they don't have insurance and they have no other way to be given a prescription for an antibiotic for a cold without it costing them $200 because they do not plan on paying that hospital bill. There's so much more, right? If you make it clear that you understand that and you still want to work there anyway, that's what you're looking at for the emergency department. Labor and delivery. I love babies. Babies are cute. I've always wanted to deliver babies. Let's see. I want to help bring life into the world. Childbirth is beautiful. The process of labor, the process of delivery, and bringing new life into the world is amazing and beautiful. And I had a clinical and I loved it, or I have just always wanted to do it. My mom does it. My sister does it. I know somebody who does it and they love it working here every day. Here's the thing. In L&D, you're not taking care of a baby. You're taking care of moms. And you're dealing with very highly stressful situations. People are bleeding out. People have very high risk. It turns from calm to chaos in a second. You have parents that have anti-medical views, and they are able to assert those, because every patient has the right to refuse specific treatments, up to and including a C-section for a dying baby inside of the womb. You have to understand that you're going to deal with all of these things at some point in your career, and you need to be ready for it. It's not about, oh, it's cute and everything's beautiful. That's not what it's about. Everybody else is going to say that. And the second that you say something's magical, or I've always wanted to do it, just so you know, you don't matter anymore. The second that you say that. And here's the thing. It's only because 100 or more applicants, even 50 or more, are specifically applying for that job that you're interviewing for. And like probably 20 of which you graduated with, and you know them very well. So you need to think these things. NICU, same answers most of the time. Tiny babies are cute. I've always loved babies. When I did peds, I always loved seeing the babies and interacting with the babies. Again, everybody loves babies until they're coding a 24-weeker. That's just the way it is. It's really not all bright-eyed and bushy-tailed. How are you going to emotionally handle being in a C-section and the baby's being delivered, everything's all magical, and then the baby's delivered, not breathing, and then you're running a full code in front of the parents, and then that baby does not make it. That baby passes away right there. That's what you're going into. You have to understand that. The bad days are extraordinarily bad, and you need to understand that as well. Same thing as if you're going into peds. So, speaking of peds, I love kids. Kids are fun. I used to babysit. I babysit all the time. Don't tell them that you fucking babysit. Don't tell them that you have a parent. Guess what? A lot of people are parents that are working. They don't give a shit if you're a parent. They shouldn't care if you're a parent. Nobody cares about that. Nobody cares that kids make you happy, or, in my case, I've been doing street magic for like 15, 20 years. I'm not going to tell them that, oh, yeah, well, I'm so fit for peds. I've literally been doing magic since I could do magic tricks for the kids and play with the kids. You're not going in there to play with kids. You're not, if you used to be a teacher, they don't care. This is the different job. This is a serious job. It doesn't matter if you used to babysit. Doesn't matter if you love kids. And again, everybody is telling them the same exact thing. You need to be the one to tell them something out of the blue. Operating room. I like surgery. Grey's Anatomy made me want to work in the OR. I think surgery's fascinating. Or I love watching procedures. Everybody's going to say that. Oh, I actually pay for this. There's like some subscription service, and I'm actually probably going to get it this year or when I graduate, but it's like a platform that has like every surgical procedure, and it's professionally done, like freaking 4K with explanations. I can sit and watch surgery for like hours and hours. I'll just randomly be bored. I'm not telling you this as an answer. I'm telling you this legitimately, personally. I will go online. I'll go on YouTube. I have premium, so I don't have to watch the ads. And I will go and watch an appendectomy just because. I just love it. I love the sounds. I love the visuals. I love how crazy the techniques are, how fast they can sew somebody up in like 4 seconds. They just did, freaking 8 sutures with slippery, bloody gloves. Like, it's cool. Everything's clean. It's nice and cold. And you have one patient at a time. Like, yeah, it'd be cool. I do not want to work in the OR. I'd get bored out of my freaking mind. Or a surgeon would yell at me and I would yell at them back and we would both get fired. So again, just think about what is, and you should purposely go out. If you're going to go, even for med surg, I don't care what it is, your chances are, if you're listening to this, you have a competitive residency program in the area and you know it, and you know it's going to be tough. You should not be disappointed if you don't get a job, no matter how good you are. Here's what you need to think. I'm going to go for this interview. What are the most common interview questions? What does everybody else say? You can find this information out, even if you have to use ChatGPT. What does everybody else say? Why do you want to work here? Why do you want to do this? Why do you want to do that? Tell me about your weaknesses. And you need to not give any of those answers. You need to give something so out of the blue. I remember that I interviewed for postpartum once. Of course, I didn't get a job. Literally like 30 people freaking like interviewed for this job. It was for postpartum as just like a nurse. It was like a nurse apprenticeship, which is basically a CNA, right? But you get exposure to the people there and all that. It would be great. It would have been a great career vector for me to get into a different department that I may or may not choose to talk about right now. Hell, I'll probably do it later. Yeah, in this episode. Why not? I'll spill all of the beans for those few of you who listen to me. I'll tell you exactly what I'm doing and what my plan is. And if anybody listens that's going to go up against me, I guess you'll know what I'm going to do, and you'll just have that much of a better chance, and the best person will get the job. But they asked me, obviously, why do you want to work here in like women's and children's? And instead of saying, oh, well, postpartum is magical, I straight up called the bullshit out. And if you want to take this if you're more of a direct person, go ahead and do this. I said, well, here's the thing. Everybody tries to get into postpartum or labor and delivery because they think it's going to be an easy job, and they think they're going to they want to have something that interests them, something where not a lot of bad things happen, and it's quote unquote cool, or they just think it's magical or something like that. And that's not why I want to get here. I have recognized just how much you have to react to things very quickly and very seriously while keeping your poker face on, which I just spent the last 20 years of my life crafting in healthcare. My perfect poker face, because you have a dad watching, you have other children there, you have grandma there, and then all of a sudden you have a mom that is hemorrhaging. She doesn't know it. She doesn't feel anything yet, but when you go and feel that fundus or do whatever or change the 10th pad in the last 5 minutes, something's wrong. She's deteriorating. Nobody else knows around you. You have to keep your poker face on. You have to do the things. You have to know what to do next, and you have to do it calmly and concisely. And while this is all going on, all of your other patients are standing around. And what I mean by that is family. The dad's freaking out. He has a new baby. He's overwhelmed by having a new child. The other children are maybe present. You have to deal with all of that situation. Mom's rushed to the OR to get an emergency hysterectomy. Meanwhile, you have 2 kids and a husband sitting in a waiting room or in a hospital room, and they don't know what to do. And by the way, nobody's in there rubbing their shoulders telling them it's going to be okay. That patient is mom, and mom's in the OR, and everybody that was taking care of her is gone. And those kids and that dad or that grandma, they're sitting in there and they don't have any answers, and they could feel like nobody cares about them. And that is why I want to get in. And she was floored by the response, and it still wasn't enough to get the job. Because at the end of the day, when it comes to some jobs, it matters who you know. But I will go there. Let's go there right now. What am I doing to try to get a residency position in the same department where I was already denied a job, despite having a literal flawless interview that ended with me getting a tour around all of their departments, and me knowing for a fact that nobody else got that tour? What was it? What is it that I'm doing now? Well, keeping in communication with those people, it was offered to me that I could come and do shadow shifts in a certain department within their department, of which I won't say right now. I have been doing that, so I'm getting to know all the nurses. I'm getting to learn information that only you can learn in this department. Basically, there's some medical information that you can get online, but for caring for the patient population that I am talking about, you cannot get this information elsewhere other than experienced nurses. Some of these nurses took 3 to 5 years or more to figure out and find out, and to be able to put into a succinct sentence or two. And I know these things, and I'm going to make sure that they know that I know this during an interview process. Networking at the same time as you're learning. Shadow shifts are the perfect way to do this. You should call around and see if they have shadow shifts in whatever department that you would like at whatever facility that you like. If they don't, try another facility, try a different department, do whatever you got to do, try to get a job in the department, even if it's PRN, outside of school, whatever you got to do. Because if these people don't know who you are and know that you're capable of really busting ass, they don't really care about you, or you don't have that good of a chance. Your chance of between somebody knowing who you are and what you're capable of and not knowing you at all, even them knowing you and knowing that you're capable only gives you about a 70% chance of getting a job, 70 or 80 at a competitive residency program. The highest you can get is around an 80%, I believe. If you have a flawless interview, the people already previously knew you, your network in the area, literally everybody likes you, you still have a 70 to 80% chance of getting that job. Realizing that alone shouldn't really necessarily scare you. It should encourage you, and you should keep that in mind. So go out there and network a little bit, and hopefully you've had the opportunity during nursing school clinicals, or you will have the opportunity during nursing school clinicals to, have some interactions with that department or the people in that department, so that you can get your face out there. And when you're there, really make sure that you stand out there as well. Okay. So that's all that I have. This is how it's all about standing out when it comes to getting nurse residency jobs. I will let you know more. I will do little updates, little personal updates, as far as the process, and maybe, 6 to 8 months from now, I'll be telling you how I pulled it off instead of how I'm trying to pull it off. Thanks so much for listening to the Earn It podcast. Go out there and earn it.